Hey everyone, welcome back to my channel. So this is an update for my excision surgery. I had excision surgery of endometriosis 3 months ago, and I kind of wanted to fill you guys in a little bit about how I'm doing after my surgery. I'm going to kind of give you a little bit of a backstory. I'm not going to share way too many details about the stuff that I was going through, but because I'm going to share that in a different video down the road, I'm going to share my endometriosis journey and kind of what I've been through and just my story, so to speak. This one's a little bit different, it's just an update. So when I was 12 years old, I got my first period, and ever since I've had my menstrual cycle, I've had issues, and it was debilitating pain. I remember the first period that I had, it was in June, whatever year that was, because that was a long time ago. But I just remember summer just hit and I was gonna go out to tan, and I got my period, and I just had the worst cramps in the world, and it's just like ever since then, I've always had pain with my cycle. I have like a high pain tolerance, and this pain would put me out on my ass. Like, it would make it debilitating to do normal daily task things. And I had friends that had their period and they seemed to be just fine, but like my cramps were so bad. And that led to me getting placed on birth control when I was 16 years old. I was placed on the Depo-Provera shot. I don't remember how many years I was on it. I know that I was on the shot for over 5 years. And then I realized that I was on it for way too long, and I heard about side effects from that shot. So I got the Nexplanon, and I got that placed in 3 times, which was a 6-year time span that I was on the Nexplanon implant. I think I was 26 years old. So that was 3 years ago. Yeah, 3 years ago now. I decided to get off of birth control completely to kind of cleanse my body, and I was like, I just feel like my hormones, like they weren't right. I didn't feel right. I don't know. I feel like, and this is personal opinion, and people might get upset for me for saying this, but personally for myself, I didn't feel like that was the right option for my body. I wanted to be cleansed of it. I'm not one that really likes to take medication. Like, I have to be in really bad pain to even take ibuprofen, and I've just always been like that. I don't want medicine in my body unless it's natural. That's just my outlook on things. But anyway, when I got off birth control completely 3 years ago, I just remember the pain would start again, and I had these debilitating cramps, and that led throughout time, my periods, like the blood started to be brown, and I'm like, something isn't right with my cycle. I talked to several different doctors about it, and they're like, oh, well, let's just put you on birth control. They wanted to slap a band-aid on it, and I was like, no, I'm telling you, something's not right with my body. I do remember when I was 21 years old, I kept getting like I thought was UTIs, because I was experiencing pain with like peeing and stuff. I know this is way like TMI, like, so if it's too much for you, you can pop off this video. I'm just being really honest about my symptoms. And I remember the doctor went in and she's like, you know, I was having all these issues, and she's like, well, you have pelvic inflammatory disease. And I was like, well, what's that cause from? And what it is it's too much bacteria that causes like an infection. And I didn't even know, I wasn't even aware that I had it. I just thought I had a UTI. And during this time, I was in a 3-year relationship, and I'm like, well, obviously I know it's nothing like gross, you know, like, like I know, so what I'm trying to say is I know I didn't catch anything. So she decided to do a pelvic ultrasound at the time. That's when they found the pelvic inflammatory disease. And then they also found that I had cysts on my ovaries. Not much was said about that. That was what was causing a lot of my discomfort, not even having my period, because even though I didn't have my period, I would get really bad stomach aches. And then I started like growing a sensitivity to foods, and I'm like, something's like not right internally, you know, like then I couldn't eat bread anymore, and then I couldn't eat, you know, I had trigger foods, and I get super bloated, and I was like having all these symptoms. Bring it back to when I was 26 and I got off of birth control, my periods progressed, and it started to get a lot worse with the pain. And all of a sudden, like towards the end, I don't know, at the end of 2022, yeah, so like a year ago, I was like, well, I'm just gonna make an appointment with a doctor, and I'm gonna get in, and I want to see what's wrong with my body. She tried slapping birth control on me, and I told her straight up, I was like, hey, I don't want to be on that. And then this is a whole nother story that I'm going to get into when I tell my endometriosis story, but basically she was saying since I had depression and anxiety, it was all in my head. She kept trying to bring up my mental health history. I'm like, no, I know something's not right with my body. And I was so upset in that appointment, like from people throughout the years in the medical profession not listening to me. And I'm not down talking doctors. I'm very grateful for physicians, and I can't imagine how hard the field must be. But as a patient, basically being called a liar for all of these years really messed with my head. It really made me feel like I had some issues. And I was like, well, I know something's not right with my body and nobody's listening to me. So I pretty much walked out of that appointment. I hadn't been that upset in a really long time. I was trying to keep my cool, and I was trying to leave in a peaceful manner when I was pissed. I'm not even gonna lie about it. One of my friends had endometriosis and she had excision surgery, and she's like, hey Ty, like I think, you have endometriosis. I'm like, okay. Well, I kind of think I do too. And then my symptoms kept getting worse. And so in July of this year, 2023, I met with Dr. Heegard in Minneapolis. He's at Hennepin Healthcare. Phenomenal guy. Within 5 minutes of my appointment, he goes, I'm pretty sure you have endometriosis. And for the first time in the whole years of my womanhood, I felt like I was heard. I felt like I was understood. I was like, I'm not crazy. Somebody's listening to me. Like, I cried on the way home because I was just so grateful that somebody took the time to really listen to me and understand where I was coming from. He ran tests, did an MRI, pelvic ultrasound. They found cysts on my ovaries and signs of PCOS, which is polycystic ovarian syndrome. So I had 20 follicles alone. I think it was on my right ovary, and then I had like more than 10 on my left. So that's where the abdominal pain was coming from, because even when I didn't have my cycle, it felt like a sharp pain, like shoot, and I'd be like, oh shit, like that hurts. Anyway, in October of this year, I had excision surgery of endometriosis with Dr. Heegard. So I'm not trying to scare you if you like have excision surgery, or maybe you've even been through this, but all I want to say is that when you have surgery, you're not gonna walk out of there feeling like $1 million. I felt like shit. I cried a lot. I was very emotional, and obviously a lot of that had to do with the anesthesia, but I just remember waking up thinking, oh my God, what did I do? And then I looked at the nurse and I was like, did they find it? And she said, yeah, they found endometriosis. And I looked up at the ceiling and I said, I'm not a liar. And I think that the scariest thing going into surgery was being fearful of the fact that people weren't gonna believe me, or being fearful of the fact that they weren't gonna find anything and then I would have been a liar, like I've been made out to be all of these years, or people made me feel that way is what I'm trying to say. I just remember the first week of surgery, like I sat on the couch. I had to prop myself up on pillows. I couldn't stay up, sleep on my back because the gas pain was so bad in my chest. Thankfully, my friend told me that, maybe try like a Gas X or something, and I bought Gas X, like I was ready, because there were 2 people I talked to that had excision surgery, and they both said how bad the chest pain is from the gas, because when you get excision surgery, they pump your stomach with air. And the shoulder pain, oh my God, the shoulder pain was so bad. So I took Gas X twice a day, and if you have excision surgery, I highly recommend it. I even told Dr. Heegard, I was like, hey, when your patients get surgery, Gas X, it's a game changer. Make sure you stay on top of your meds. They'll give you some stronger ones for a few days to hold you over. Let me tell you, when I say you want to stay on the clock with your pain meds, I'm not joking. I stayed on the clock. I set alarms. And I stayed on top of it, and it helped me heal a lot faster. I think it was 11 days after surgery, I went for my first walk, and that I was very winded, I was very tired for a month. And I went through this really weird phase where I just wanted to be alone and I didn't really want to talk to anybody. I do know that a month prior to my surgery, I was very emotional. I'll put the link in the description below. I have a very emotional video about my thoughts, feelings, emotions, things that I was going through before surgery. I was fearful. I lived by myself, on my own. Granted, I stayed with my dad for a few days after surgery, but there's no better feeling than just being home. but I was scared of how I was gonna take care of myself. And if you have excision surgery, make sure that you are easy with yourself, you give yourself grace. It's gonna take you time to bounce back and recover. You're gonna wanna make sure that you're drinking plenty of fluids. You wanna make sure that you're getting enough rest. It took me, I think, 2 weeks before I could lay on my side because my abdomen was just so inflamed. Another tip that I want to say, if you have excision surgery, stock up on snacks. I was on like a pudding and applesauce diet for a week because my stomach was just so sensitive. I mean, they cut you open in 5 spots. They did for me anyway. Every physician or surgeon is different, but they cut me open in 5 spots, 4 on my stomach, and then 1 down the center where my belly button is. And I'll show you that to you right now. All right, I know that this is probably not the best setting. This is my bathroom, but I don't have any other way of showing you guys. So these are my incisions. I got lines here from my jeans, but you can see here, this is where the incisions are. This is where they cut me open, and then they cut me open in my belly button. And I forgot to mention it, but they did take out my appendix as well because endometriosis is known to go around your appendix. So in light of the situation, my physician removed it because he's like, I don't want you to have issues with this down the road. So yeah, I had an appendicectomy, I think it's called. But yeah, this is my stomach. I'm healing up good. This one in particular, this incision here, I was a little bit concerned about because it looked pretty ugly when it like was first there. But yeah, they're healing up good, and I think within a few more months, you'll hardly be able to see them. So I forgot to add one thing to help with nausea, because if you're a person that gets like really nauseous after surgery, make sure you're staying on the clock with eating. That's gonna help with your nausea, because I struggled with nausea for like an entire month. I just felt like I was gonna puke, and it was the worst feeling. So post-surgery, it took me a little bit of time, but I slowly progressed. Like I said, 11 days after surgery, I started walking. I was very due diligent about making sure that I got exercise, and I was exercising my body and trying to build back up my strength. And then it turned into like a couple times a week I'd go for walks, and then it was more and more and more. And then I think it was like a month after surgery, I was walking almost every day because I was starting to build up my stamina again. Right now, I don't know, I guess I started going to the gym about a month ago, so like 2 months post-surgery, I started going to the gym again, and I'm very weak still, but I'll tell you what, it feels really good to be back into the swing of things. I did want to talk a little bit about my symptoms after surgery. So one thing that I have experienced, and I think it might be a hormone imbalance, is especially when I'm anxious. I've never struggled with sweaty palms, but it was the grossest thing when I get like anxious or out of the blue, my palms started sweating, and then I got excessive sweat under my armpits for at least the first couple of months out of surgery. The hand sweating's not as bad, and I know you shouldn't probably Google your symptoms, but I'm like, what's going on with my body? And it said something about your hormones being out of balance. Going forward, I guess I want to look into getting on a progesterone supplement. I don't want to be placed on birth control. That's a personal choice of mine because I'm doing what I think is best for my body. Everybody's got a different opinion. I fully support that. They did recommend, I think it was called the IUD, to get that inserted, but that whole idea just like grosses me out, and I don't want to be on birth control. I know that when I was on birth control, I would get like nauseous, and I know I didn't feel good, and my mental health was worse. I'm gonna look into getting my hormone levels checked. I found a naturopath in the area. I'm gonna get my blood work done, and I'm gonna meet with a naturopath and kind of go over what vitamins I might be deficient in. I started to take magnesium because that helps absorb vitamin D, which vitamin D helps you with like your mental health, like depression, anxiety, kind of stuff like that. I do want to say a month before surgery, I do want to mention that I was extremely irritable. I was not okay, and you'll see that in the video. I was not doing good. I was really crabby, and I was so crabby to the point where I stopped being around my community. I stopped really kind of talking to anyone because I was just in a really negative headspace, and I'm like, I don't want others to be consumed by this. So yeah, that is my 3-month post-surgery update. I hope you guys got something out of this. There is going to be a much longer video down the road in the future. and I'm going to talk about a lot more in depth of what I went through in my story, just so women know that they're not alone, and just to kind of spread awareness of endometriosis, because had it not been for my best friend going through excision surgery, I would have probably not known much about it. I really didn't hear about it until she had excision surgery. So my biggest advice to you if you're watching this is to listen to your body. You know your body the best. You're not crazy. And throughout this journey, I've had several different women reach out to me and be like, hey, I was feeling like this, and this too. And I want to highly recommend getting into the Facebook group called Nancy's Nook. I might link in the description below, but that is where I found out about who Dr. Heegard was. They'll have recommended specialists on there. It's a good support group for people, you know, people to lean on so you don't feel like you're so alone. But anyway, thank you for watching, and stay tuned for my full story down the road here soon. Thanks for watching.